My name is Eugenia Trigoso. I am clinical nurse, and I have been working for several years in pediatric oncology and also in bone marrow transplant. Is where I met Angel quite a few years ago. And after this, we met again in Barrestown. That's a nice camp that is in Ireland. So I would like Angel to introduce himself.
So my name is Angel Asins. I'm from a small town in Valencia, in Spain, and I had leukemia when I was 12 years old. And then I had my treatment, and then when I finished my treatment, I continued working with or helping as much as I can with things related with cancer, with some local associations like Aspanion here in Valencia, and also Serious Fun and volunteering in Barrestown, this camp. And now what I do is manage educational programs with universities for inclusive education. Yeah.
What does it mean, inclusive education? It's just for patients, other people who have cancer, or like
I
any
work.
might
I
need
work.
some.
I work with people with disabilities. So my field is people with disabilities, and what I do is we have some programs. I work in Fundación Once, that it's like the main organization working with people with disabilities here in Spain. And we do programs with universities for promoting the access and promoting a better life in universities for people with disabilities.
And how did you start there? How do you start that path? It's just like it's related to like your story, right? Like what you went through.
Yeah, this brings me to my illness. I had leukemia, and a side effect of the treatment was that I lost the strength of my legs. So I had to recover it, but I still walk with crutches. So I have a disability, and I went on my Erasmus because I like to travel. I like to meeting people and going abroad. So I went on my Erasmus to Poland, and my university asked me to tell my story, and then a person from here, from Fundación Once, saw me and told me to work here with them. I did, I'm a sociologist. So they have like a job for me, so I came here to work.
That's so inspiring, I would say, to all the people who will be hearing this. Oh, you're muted.
Yeah, Eugenia, you're
Eugenia, we cannot hear you.
I have to say that I have been taking care of Angel when he was 12 years old, but after this has been very nice when I met him again in Barrestown. When I saw him, I said, Angel, what are you doing? I have to say, not the first moment, I didn't realize having him. He said, but Eugenia, I am Angel. I can't believe this. He has been grow up different. He's even not a teenager, that is a young person with a very strong head. He is able to have a very, very nice life, very, very nice life. And Angel, I would like to ask you some questions. Yes, we are in our coffee time now, so I have some questions for you. Could you describe some memorable moments during your treatment, something that left a lasting impact in your life?
So I would say this side effect on my legs was something that was not easy in the beginning, but now that I can see it from how I am right now, or who I am right now, I can say that this left me an impact on my life, because I think that my decisions from this moment has been related with this problem. And since when I chose my degree, also I think that the illness has had an impact on my personality, on my decisions, and on everything on my life. So I think this would be the first one. And also I had another moment when I was on my transplant. They discovered that I had Wolff Parkinson White syndrome on my heart. So from this moment, well, I like to travel a lot, and this caused me like arrhythmias, and in some moments that I didn't expect to have these problems, because you don't expect to have this arrhythmia, so it can appear in every moment. So this was something that affected me a lot, because I was not like sure or calm in any moment, because it could happen in wherever, or so I was traveling, like I went to England for living for a month, and it happened to me, this arrhythmia there in England. So after that was really difficult, because I was in panic every time I had to travel, because it could happen everywhere, and I was just 14 years old. So it was difficult to go with the heart beating uh, maybe 300 beats per minute. So and explaining the doctor that this is happening to me. I have this. So
That
it
poor
was
ER doctor.
in another language. So it was something that was really difficult for me. And then I had a surgery, and they fixed this problem in that surgery. So this is something that changed a lot my life, because I get to lose this fear of doing whatever, because I was in panic that this could happen. So I would say these two moments were something that affected me and have had a lasting impact on my life.
Right. And was there any person or
Thanks, Angel. But why do you think that is so important? Because according to your experience, what do you think that is so important, the psychological support in the reintegration of patient, the society after the illness?
Yes, so
And the second part of this question, do you find a psychological support in your life?
so I think that this psychological part of the illness has to be improved, because sometimes hospitals focus this psychological help while you are having your treatment and everything, and it's okay, because you have to have this tool for your treatment, and that traumatic moment. But I think that and after talking with some friends that have had the cancer, and now, like 10 years later, we are also having these side effects that cancer affects your psychological needs. And like even 10 years after, you find out that you have something that is not working because of what you had 10 years ago. So I think that psychological help should be a must even after the treatment, because cancer doesn't finish when you finish your treatment. So in my case, for example, I had some problems with when coming back from to the high school, because that happened to me when I was 12 and 13 years old. So it was like the 2 first years of my high school. And you know that in that moment is really important, your aspect and how you look and everything. So I spent 2 years at the hospital, and then when I was coming back, it was like everyone have been socializing around this normal life, and it was not the same for me. So when I came back, was like, okay, so I don't know where I am. My body was with these side effects of being fat and everything related with asteroids and all these things. So it was difficult for me to accept that I don't have I mean, that people don't like me and everything. So when you are a teen, you need this improvement from other teens, mostly, well, in my case, mostly girls. And it's something that maybe it's silly, or but when you're a teen, affects you. And and in that moment was something frustrating, and with psychological need, I think that um, would be easier to go through this way.
So who was your support during that time? Because, we've all been teenagers. We
Yeah.
know it's hard. And like coming from your experience, adds like a couple of extra layers of, complexity. So when you were like 13, 14, like a preteen getting into teenage years, what was your support? How did you make it through? Or what would you wish you would have had at that time?
Well, mostly my family. Of course, my family was there in every moment. Also, I'm so thankful for my group of friends that I had at that moment, because they were counting on me on every plan, even if I was in a wheelchair in that moment. So they were trying to count on me, but I couldn't ask them to change their plans, because also that's my personality. I couldn't ask someone to change their plans because that's not accessible for me, or I can't do that plan. So, but I'm really thankful for this. But at the same time, you cannot change the personality of a group of teens just because you have not been living the same as them. So I don't know if a single person would change, like a psychologist would change this moment, but maybe would have helped me to realize that how they are, how teens are,
Right.
what are we going through in that moment, because we are all the time thinking on some things, and
Right. To
then,
normalizing your fears that we all go through at
yeah,
that time.
because
Right.
yeah,
Kind of like that context, more clarity.
yeah, because in that moment you think that you are not the normal person, and you are blaming yourself because of this. Also, something that helped me a lot was Barstown, that camp. When I went there, I went there when I was 14 years old, and I realized that there were more people going through this, and and I realized that you can do things like I don't know. I climbed there, and I was in a wheelchair, so I realized that maybe I was not the person who are not ready for the world, but maybe the world is not accessible for me, and I have to change the world. I don't have to change myself, because I have something that it's difficult to change, and I cannot change it, and I don't have to change it, but I have to change the world and the accessibility, and everything that it's in my hand. So Barstan was something that really helped me a lot.
Angel, it's so nice to hear you talking.
Thank
Because
you.
you're such a history of resilience, right? And I mean, you went through a lot at a very young age, but you persisted and you like figure it out, even through while going through being a teenager, which is by itself really hard for everyone, right? I think this would be like for whoever is listening to this talk, who wants to join us with a coffee, it would be important to know that there is a way to go through those years and going through cancer treatment and succeed as you did.
Yeah, of course, but it's the only way. I mean, the other way is like not accepting things and blaming yourself, and I don't know. Normally, I don't say that I was the one who succeed going through this illness, but I think doctors are the people who made me and made the other patients to go through this. Doctors, nurses, all the staff that works on the hospitals, and I like to do it this way because I think that they need even more help than us, because I think that if we help hospitals, if we help doctors, if we help nurses, I think that more patients are going to go through this treatment in a better way, or even to succeed in their fight. I don't like this word, but in the fight against cancer.
Yeah, in this path, we can say, if you prefer.
Yeah.
How could you help us? Because I do agree with you, we need help. But what would be, right? A lot.
Yeah.
But what were the things that you feel were missing